Cataracts are the leading cause of vision loss in the world, accounting for 50% of blindness. And they don't just affect old people. They definitely get them more than younger people, but anybody can get cataracts. However, you can reduce your risk of cataracts. Let's go through their causes, effects, treatment options, and ways to prevent them. And as a bonus, later I'll explain how getting cataract surgery can give you a superpower of seeing ultraviolet wavelengths that are normally invisible to people. A cataract is a clouding of the normally clear lens in your eye. Its main symptom is blurry vision. The main cause of cataracts is just natural aging, where the different proteins in your eye end up clumping together and forming those cloudy regions. There's also a genetic component, so your family history plays a role in whether or not you develop cataracts, and people with diabetes are at a higher risk because changes in blood sugar levels affect the lens in your eye. And don't stare right into the sun too much. Prolonged ultraviolet or UV exposure from the sun can increase your risk. So does smoking. The last cause I'll talk about is trauma. Not emotional trauma, but if the lens in your eye is damaged, that can lead to cataracts. Okay, but how do cataracts actually impact your life? Again, the main symptom is that your vision becomes blurry or hazy. This affects both distance and close-up vision. Cataracts can also make it harder to see at night, either increasing glare or just making it harder to detect things in low light. But the double whammy is that in addition to making it harder to see when it's dark, it makes you more sensitive to bright lights. Cataracts can also lead to double vision, which is the same thing that would happen if you had a lazy eye. That's all pretty bleak, but what can you really do about cataracts? The main treatment is surgery. Basic cataract surgery involves your natural cloudy lens being removed and replaced with an artificial lens. This can significantly improve your vision. It's also common to use ultrasound to break up that cloudy lens before removing it. There are a few different kinds of artificial lenses. You could have a monofocal artificial lens, which is basically the same as the natural lens in your eye, or you could have a multifocal artificial lens. If you have progressive lenses that allow you to magnify things up close better for reading while differently affecting things far away, this is basically building that into the lens of your eye. You're kind of a cyborg. You could also get a toric artificial lens. So if you have astigmatism, your glasses or contacts are curved differently in perpendicular directions to correct for that, and this is again building that into the artificial lens in your eye. And a lot of more advanced cataract surgery techniques use a laser for different parts of that process. A lot of ophthalmologists like to do a pre-treatment using a laser to soften the lens before they go in for conventional cataract surgery. Thankfully, because the natural lens in your eye has been removed, it's impossible for cataracts to come back. However, some patients experience something called secondary cataracts, which is another clouding of your eye caused by scar tissue on the back of that new artificial lens that was put in. But weirdly, having cataract surgery can give you a superpower. So having the natural lens of your eye removed can let you sometimes see ultraviolet light that you normally wouldn't be able to see. Basically, the natural lens of your eye filters out these wavelengths, while not all artificial lenses do that. So sometimes people may report seeing more blue or purple colors after cataract surgery. In fact, the painter Monet had this surgery, and a lot of his work ended up more blue and purple after this fact. So some people speculate he was just seeing more of those colors because of the surgery. While cataracts are just a natural part of aging, you can delay their onset by protecting your eyes from UV radiation, not smoking, just in general maintaining a healthy lifestyle, and, when possible, managing health conditions like diabetes. If you're experiencing changes in your vision and think you might be getting cataracts, it is super important to talk to a real eye care professional for a proper diagnosis and treatment recommendations. Please click to watch my video about what your glasses prescription really means, and definitely leave me a comment if there's another eye-related topic you'd like me to talk about. Thanks.